Let me remind you that for the last several weeks, one of the things that I've been doing is trying to tell folks that our overt concentration on the Russia scandal was really going to hurt us in the long run. Not that Russia is not important, not that the president is not likely guilty of all of these things that he's accused of, but what I'm saying is a whole lot of it would be a smokescreen for the Republicans to get what they want done. And all of that is starting to come together. Today it has started to come together over the last several days, but now it is a concerted effort. Let me tell you, folks, it turns out I got this email from HHS today, right? And the first thing it says in the email is it wanted to let everybody know the following. Health and Human Services Secretary Tom Price, MD, issued the following statement regarding compelling data today by the Centers of Medicaid and Medicare in two new reports related to Obamacare. The effectuated enrollment reported for the most recent enrollment period and the health insurance exchanges trends report. The reports show a decline of the number of Americans who have actually purchased coverage on the exchanges, with costs being a primary concern. Also, not surprisingly, as costs continue to go up, fewer Americans can afford to pay more and get less for health care. Many individuals and families across the country are tired of having their healthcare options dictated to them by Washington, particularly when those limited options are affordable. That's why every day we are working on behalf of President Trump on solutions that will show a little humility from the federal government, equip states to serve their unique and diverse populations, and put healthcare decisions in the hands of patients, families, and doctors. Why am I bringing that up? It is important for folks to remember. What I said several months ago was that Obamacare has some problems that people are going to feel right now. They're feeling the very high prices. In fact, the high prices are in September and October, they will get the shock of their lives from Obamacare. Now that said, what was lacking from our side was preparing them for that by letting them understand that what HHS director just said in this memo that he sent to the entire mailing list, millions of people received this email. First of all, the email is telling a particular truth. The healthcare is going to be unaffordable for a whole lot of people. And number two, that one of the reasons, and less people are enrolling, and the reason less people are enrolling, of course, is that HHS is no longer doing the job to advertise Obamacare, to advertise the Affordable Care Act. We should have, Democrats, progressives, everybody else should have been putting the information out, one, that the current administration is sabotaging Obamacare by, one, not advertising it appropriately for the people who need it and would use it, and secondly, for cutting monies from Obamacare where necessary. With these emails that they're sending out now, they're laying the path for the reason why it is necessary to pass Trumpcare. If you notice, Trump had several senators in his office today. They have laid out much of the work in the places where they need to lay out the work, places that they're not in too much danger, even if they pass this draconian bill, which they intend to do. Secondly, if you go to the YouTube channel for the HHS, while we were concentrating on Russia, they got a whole lot of testimonials from people's stories, real stories, with the pain that they are feeling with the current state of Obamacare, which they are actively destroying. Again, let me repeat that. They are filled, the HHS YouTube channel is filled with testimonials from everyday Americans telling them how Obamacare has been bad for them. What have we done on the progressive side to really show what needs to be done, one, and two, why the problems that they're having are really not the fault of the Affordable Care Act, but in fact the fault of the sabotage by Republicans, not just under Trump, but since 2010 when they took over. So folks, what are the marching actions? We are far behind the curve again, as usual, because our politicians have no foresight. That is a fact. Our politicians who should be supporting this jump on the same talking points. They jump on the same, groupthink, And instead of listening to those of us who are continuously saying, these guys are working behind the scenes. While you are looking over there, they're building an infrastructure to make sure that they have the pathway to Trumpcare, which is nothing more than a tax cut bill in order to provide a large tax cut after the bill is passed. Folks, you don't have much time. You have a lot of work to do. I don't know how successful it's going to be right now because of how far we've allowed ourselves to get behind by doing the things where we shouldn't be doing, but we are at a flex point right now. We are at a flex point right now. We can go in either side whether it passes or not. Remember, everybody thought when it died the first time in the House, there's no way Trumpcare was going to come back. It came back. It got passed. It went to the Senate, and the intelligentsia, our progressive intelligentsia, pointed out that the bill was so disastrously polling that there is absolutely no way that bill was going to get through the Senate. Guess what? They built an infrastructure. One, Trump has them to the White House. Two, Mike Pence and the current HHS director, Tom Price, they are on a country tour, going through the country, pointing out all the things that are wrong with Obamacare. The people can't afford it. And remember, also, a lot of these companies, insurance companies, have in fact pulled out of the marketplace. That is dangerous because there are a lot of counties right now in these United States of America where nobody will get health care on the marketplace. Let me tell you what that means. It doesn't mean they can't buy individual policies. They can buy individual policies, but by law, the only subsidies that are provided are subsidies when those insurance products are purchased on the marketplace. So they are killing Obamacare in a lot of different ways, my friends. They're killing it. Let's start calling it ACA again. They're killing it not because it was written incorrectly, because it was written flexibly. And because it was written flexibly, these guys are able to do this. We need to keep our eyes on the ball. We've been talking about that for months now. On most progressive sites, I've been getting hell for saying we're keeping our eyes off the ball. Forget Russia will take care of itself. There are professionals taking care of Russia. We need to be all out. The battle right now is healthcare. You care about those 12% of people who are on the individual markets. This is a fight. You care about your own. You care about your own healthcare as provided by your employer. You better fight. Don't think Trumpcare is only affecting those 10 to 12% on the individual market. If you get healthcare through your employer now, beware women, because right now the laws are being lessened. The EEB, which were the 10 things that all insurance companies had to provide. The 10 things all insurance companies had to provide. That is no longer the case with Trumpcare. They can buy out of it. They can get out of it. So folks, we've been making this mistake over and over again. The question is, will you get the media and everybody else to take their eyes off of Russia and put their eyes on the ball, on things that actually affect middle class, everyday Americans, bread and butter issues? Healthcare is the first one that is going down. And if you don't get with it, if the party doesn't get with it, if they don't start talking about it, all I hear today on is Russia. On MSNBC, CNN, all I hear about is Russia. So folks, get busy. Thank you for listening.